Well, every year, dozens of people from around the world come right here to Hampton Roads to have a serious medical condition treated.
Now, we're talking about a deformity called Pectus excavatum. It makes the patient's chest look like it's caved in. Then your side health reporter Stephanie Harris takes us inside the operating room with the doctor who developed the treatment. Stephanie?
Well, Tom, we want to warn viewers, some of the video in this report is not for the squeamish, but we do want to show you firsthand just how vital this surgery is for some kids. Stephen Novak isn't shy about showing his chest, even though he says he's been teased about it at pool parties in his home state of Florida.
In my case, sometimes it sinks in the middle, sometimes it has asymmetry on one side or the other.
As a child, he says he just dealt with his sunken-in look. But now that he's in college, it's hurting more than just his feelings.
There definitely is a trend to notice chest pain if you're running or if you're carrying a backpack on campus.
That's why Stephen's having surgery at Children's Hospital of the King's Daughters in Norfolk. It's where Dr. Donald Nuss developed a procedure that uses a steel bar to reshape the chest.
We routinely hear from the patients, I cannot believe how much easier it is to breathe. I cannot believe how much easier it is to run.
Hold that retractor, please. Okay.
Inside the operating room, Dr. Nuss and his partner, Dr. Robert Obermeyer, show us just how serious the condition is. This green line marks Stephen's chest wall, and this is his heart. It's so squished.
There we go.
Dr. Nuss says often the heart can't fill properly. He says other patients have compressed lungs and trouble breathing.
Pull back, pull back.
Now it's time to give Stephen some space. Surgeons take a steel bar like this and bend it to fit each individual patient. Then they put it in their side, and as soon as they turn it, you can see that chest wall pop up.
1, 2, 3.
Because of his size and the shape of his deformity,
And then you can see the bars holding up the sternum here.
Stephen needs 2 bars. This time, you'll really see his chest take shape.
Oh, yeah.
The next day, Stephen's mom says he can't stop looking in the mirror.
Yeah, I looked once in a while.
It's a big change.
Oh yeah, I get a little teary-eyed. I mean, I've had this for 20 years, and to see a difference, like even when I'm sleeping, I just go, I wake up, I'm like, oh man, I can't believe it.
And he can't wait to show it off at the next pool party. Now, Stephen will have that steel bar removed in 2 or 3 years. Dr. Nuss is hopeful that one day they'll have a bar that absorbs into the body and won't even have to be removed. For more on the surgery and who's a candidate for it, just log on to wavy.com.